Good morning, anesthesia providers and recovery room nurses. I have one question for you to start. How does floppy fish make you feel? Some of you are probably thinking you have no idea what floppy fish is, while others are thinking that you never want your patient to experience floppy fish. So, first of all, I'm going to tell those who don't know what floppy fish is. Floppy fish is a term used in anesthesia for a patient who has been reversed from their paralytic and awakened from anesthesia, but is still weak because they have residual neuromuscular blockade on board. This patient presents very weak. They resemble a floppy fish, which is where it got the name, and although they're breathing on their own, they're not breathing and ventilating as they should be, and it's just all around not good for the recovery of the patient. So I'm going to tell you guys all about how you can never have a patient experience floppy fish again. But first, I'm going to tell you a little bit about who I am. My name is Ashley Sledge, and I am a DNP student at Union University in nurse anesthesia. Prior to nurse anesthesia school, I received a bachelor's degree at the University of Mississippi Medical Center in nursing, and I worked as an intensive care nurse there in the cardiovascular ICU transplant unit. So I know a little about what your recovery nurses go through. I recovered patients in the ICU, and so I know what happens when patients wake up and all that type of thing. So I think that this is a very important message for everyone involved. And so enough about me. How are the patients going to never experience floppy fish again? And that is with the advent of the new and cutting-edge drug Sugammadex, also known as Bridion. So, some of you may know, but Sugammadex is a cyclodextrin molecule that binds to your steroidal muscle relaxants, reversing them. Steroidal muscle relaxants are your rocuronium and vecuronium. Sugammadex leads to the almost immediate reversal of those, and is a new development, really awesome thing to hit anesthesia, and an alternative to the use of anticholinesterase as a way to reverse your paralytics. So today I'm going to talk to you about the benefits of using Sugammadex, the risks, and the things your patients need to be educated on, as well as the appropriate way to dose Sugammadex as providers. So, first of all, the benefits, which are a huge biggie with Sugammadex, are that it leads to the immediate, almost reversal of these steroidal muscle relaxants. So, if you're in the anesthesia world, you know about those can't intubate, can't ventilate situations. In your nightmares, you might know about them. So if you get into one of those situations where you have completely paralyzed your patient on induction with rocuronium or vecuronium, and I'm talking about that 0.6 to 1.2 milligram per kilogram dose of a rock to fully paralyze your patient on induction. So if you give that and then you get into that airway emergency situation, can't intubate, can't ventilate, you can give Sugammadex at the appropriate dose, which I will discuss in a minute, and immediately reverse that. So that prevents a lot of negative patient outcomes and is overall better for the patient. Other benefits that are seen are that patients who have been administered Sugammadex experience within the first hour postoperatively a lot less post-op nausea and vomiting compared to those who were giving the anticholinesterases like neostigmine which are what are typically used as reversals before the advent of Sugammadex. And since there's less post-op nausea vomiting, there are less antiemetics used, which leads to less exposure to patients with drugs that prolong the QT, like Zofran and droperidol, and the other side effects that can be seen with these antiemetics. So that's amazing. And another amazing benefit of Sugammadex is that there's less residual neuromuscular blockade. So you give Sugammadex and your patient is at the appropriate dose. Your patient is completely reversed, no residual neuromuscular blockade, no more floppy fish like you've seen with the neostigmine in the past. So what are the risks of using it? That's also important to know. But first I want to note that the negative side effects usually seen with the administration of Sugammadex are with the doses that are on the high end of the spectrum. So I'm talking the 16 milligram per kilogram dose is where most of the negative side effects are seen. And these are hypersensitivity reactions that stem from anaphylaxis, circulatory collapse, typical allergic reaction situations. That's of a concern for those who are exposed to the large dose. Also seen are nausea, vomiting, parasomnia, things like that. Another thing that patients need to be educated on, as well as the caregivers, that I do not feel like currently there, I think there's kind of a miscommunication on this, is that when patients of childbearing age have been administered Sugammadex, their hormonal contraceptives can be altered for up to 7 days. So these drugs, the birth control pills, IUDs, things of that nature, can have a decreased efficacy for up to 7 days. So patients need to know that they need to use an alternate type of birth control for up to 7 days after being exposed to Sugammadex. And now we're going to kind of get into some dosing. I've touched on a little bit before, but here's the meat of it. Dosing of Sugammadex is based on actual body weight. So very easy for providers, no ideal body weight formulas needed, anything like that. Actual body weight. It is also based on results from a neuromuscular stimulator. And this is a huge misconception with the drug Sugammadex. Providers think since it's awesome and you get immediate reversal that you don't need to use a neuromuscular stimulator. However, your dose is based on the results from that, and if you're not using it, you are more likely to give inappropriate dosages, cost your hospital more money, expose the patient to more drug, which increases their risk of a negative reaction. So you still need to use the neuromonitoring and to determine the appropriate dose. So the first dose that is appropriate to give is after spontaneous recovery. The patient has 2 twitches on the Trainor. At that point, you give 2 milligram per kilogram actual body weight. The next dose that's appropriate to give is if the patient has no twitches on the Trainor and 1 to 2 post-tetanic twitches on the Trainor, you give 4 milligrams per kilogram actual body weight. And lastly, the dose to reverse a full paralyzing dose of rocuronium that was just a given in one of those situations we discussed, can't intubate, can't ventilate situations, you give 16 milligrams per kilogram to reverse immediate full paralytic dosages. And I have never seen it given that way. That's the way that Merck, the drug company, presents that it should be used and used effectively. So now that we've gone over that, I'm going to review that. 2 milligrams per kilogram for 2 twitches on the train of 4. 4 milligrams per kilogram for 1 to 2 post-tetanic twitches. And then 16 milligrams per kilogram for immediate reversal of a full paralytic dose of rocuronium or vecuronium. So now that you've heard all about Sugammadex, you should know what it is, what the risks are, what the benefits are, what your patient should be educated on, and how to appropriately dose the drug. So if you take all this information home with you and use it in your practice, then you may never see floppy fish again. Thank you for your time.